Being healthy can be this easy. Stop for a self-care break. I have literally hundreds of options for taking care of yourself on my website. Here's a simple example. Let's exercise your lungs by pushing into its outer limits. How much can you fill those lungs? And then how much can you exhale? Inhale, but don't stop. Can you get more in your belly? Can you get more in your chest? Can you get more in your throat? That's about it for me. And then exhale. Push. Can you get any more out? And then fill. Two or three breaths like that and you're at a minute or more. And then we'll just stay in our chair and rotate the knees back and forth. When you rotate, try to get your feet on the sides of your feet as much as you can. Put pressure. You're stimulating acupoints as you do this. And just go back and forth. And like I can feel a little tenderness when I go this direction. I don't want to hurt it, but I do want to give it some attention and some pressure. And just back and forth. The inside of the foot is spleen. The outside of the foot is bladder. And 3,000 years of experience said we can actually influence organ function with these points. The National Library of Medicine says that's well documented and an established fact that these points improve organ function, relax your body, and increase your metabolism. Are you kidding me? We need to be taking advantage of the easy. This is called low-hanging fruit, when you can improve your health so much with such a simple little process and in such a short period of time, about a minute, and then we'll move on to the next exercise. In neurologic rehab, they use something called cross crawl, which is essentially the gait process of moving one arm and one leg. And so in exercising that and pushing your limits a little bit, you are massively increasing coordination for daily life. So it's this simple. Opposite arm to opposite leg, and then back and forth. And to stretch our limits, we want to increase the pace. And slowly bring up the pace of your movement. Somewhere in there, you lose coordination. So just back it down to a pace that you can hold. And then feel free to test your coordination. This is how they do it on the side of the road. Oh, right on. Should be pretty close to right on in a healthy central nervous system. And then we'll incorporate more points with our movements. So if we clasp behind the knee here, we are contacting bladder 40, which is the command point, meaning that it has a lot of influence over the entire spine. It might be the most common point used for back pain. We're going to hold it and then bring the knee in as far as it'll go and then try to straighten out. And you can let go a little bit, meaning come down a little bit to get it to straighten out, but try to hold as far in as you can go and try to straighten out. And we can just do about 30 seconds on each side. And we're stimulating our body, muscles, joints, brain, and the meridians. That's one of the benefits of movement. is it is another way to stimulate your meridian system. So we'll do 30 seconds on this leg. And then we can go back around and start over at the breath, or take another 4-minute break after lunch. If you'd like access to all my movements so that you can get better and healthier by the day, by the week, by the month, even though your age is going like this, check out my website, $27 a month. See how good you feel after a month of doing this.